All right, so there are sex positions that could literally kill you. And if you're not aware of how this could possibly happen, that's why I'm creating a video like this today. Joining me on the show to have a very in depth conversation about this is Dr. Kelvin Owusu. Now, let me tell you something. He's written a very interesting blog post that I think everybody needs to check out, and I'll leave a link to that blog in the description of this video below. So don't worry, don't stress, I've got you covered. But before you go and visit that link, this is obviously a conversation you need to be a part of. So let's say hello to Dr. Kelvin Owusu. Good to see you again. How are you doing this time?
I'm very well, and thanks for inviting me back. I'm super excited.
Ah, man, it's so good to see you. So, I mean, let's jump right into this conversation. But first, I'd like us to give it some context because, I mean, sex positions dangerous. Most of us will never put those two words in one sentence. So, what are we talking about here?
Well, I mean, sex is one of those things that is supposed to be pleasurable, it's supposed to be enjoyable, and we definitely don't want to end up in an emergency room because you went out there to have a bit of fun, but it does happen. I have actually encountered quite a few patients who have come in after a sex injury. And so, yes, it does happen. And one of the reasons why I actually put that article out is because a lot of us, like you said, are not expecting that kind of outcome. And so they are not even looking out for it. And sometimes when it does happen, they may not even be aware that this is something that needs attention. They just take it in their stride, especially the women. The women tend to keep a lot of things to themselves. And so I'm hoping that as we throw more light onto this, people are going to realize that some things can go wrong and they will start putting measures in place to avoid them. Or if it does happen, they will come in earlier so that we can help them as best as we can.
Sounds fantastic. So, what struck me though about this particular blog post or article that you put together was the fact that you chose to mention one sex position that's really, really common all over the world. In fact, Christians will swear by it, and any other sex position almost sounds sacrilege. I'm talking about the missionary. You say the missionary position is dangerous? How is that?
Well, so there are several sex positions out there. There are some of them that are obviously deadly. I mean, I saw a picture of one. I mean, the butter churner, and if you see how the woman is turned upside down with her head on the floor and angled awkwardly, I mean, that screams emergency room. I mean, you don't even need me to write an article about that one. Like the image alone tells you that this is emergency room waiting to happen. You know, and so I didn't want to focus too much on those ones because, like I said, they are quite obvious. But then the ones that I mean, majority of couples engage in, that's the one that tends to get overlooked. But it actually presents itself quite a challenge. So you met the missionary position, for instance. There are two main things that could go wrong with the missionary. The first one is the easier one. So let's deal with that quickly, and that is
Okay.
urethritis or cystitis. The urethra of a woman is quite short, right? It's only about 4 centimeters or so, and the urethra is what connects the bladder to the outside. So when you feel like peeing, when you go to pee, the urine comes out through the blood from the bladder through the urethra into the outside or into the loo, right? That's the urethra.
Hmm.
Now, the thing that makes the missionary sex great is the fact that you have full body contact, and the penis, as it goes in and out, gets to stimulate the clitoris as well. That's great.
Okay.
But you see, between the clitoris and the vagina, there's that thing called the urethra, which is in the middle. And so this stimulation
Okay.
also tends to affect the urethra and it irritates the urethra. It's not a pleasurable thing when it comes to the urethra, it's an irritant. And this irritation then could result in germs being transported from the outside through the urethra into the bladder, and that could establish an infection later on. And so this is actually why it's advisable that after sex, every woman needs to go out there and needs to go and pee right after sex because it helps to
Hmm.
cleanse the urethra. It helps to cleanse whatever germ has gone up the tract and it washes everything out. So it's actually one of the things that we advise. In fact, there's a condition called honeymoon cystitis, which is very common amongst women who get married and you're enjoying the honeymoon. That's their first sexual encounter, right? And because they
Okay.
haven't had this experience, they don't know that they are supposed to urinate, and it ends up in the hospital in the emergency room. So that's one of the ways that missionary can end you up with me.
Wow, this is very interesting. I mean, so you would advise that after a missionary position or sexual encounter, women have to pee.
Yes, that's actually an advice that is. I mean, if you take it, it would actually be of benefit because, like I said, um, the urine flowing outwards would wash out the urethra and even the bladder as well, and bring out whatever in there that is not that should not be there. So it's actually a good advice to pee after having any form of sexual encounter, especially if it's an encounter that has the potential of transferring germs into the urethra. I mean, to the urethra into the
Makes
bladder.
absolute sense.
Mhm.
Yeah. So what about like the importance of, for instance, taking showers? Does that happen? Like, is that important before a sexual encounter? Because there are people who will be like, especially guys, they'll be like, oh, women should go shower, but they're fine, kind of thing. You get that a lot. Is it important? Does this help in any way?
So, I mean, technically or medically speaking, taking a shower before having sex does not necessarily change anything much, especially except in the event that there's an obvious issue. So, for instance, I mean, and typically this would be the man. Let's say the man has returned from work. Let's say he's an outdoor worker, for instance. I mean, sweaty, dusty, etc. Remember that the whole sex act, the sex act itself, puts the woman at a disadvantage, and this is a fact. The sex act itself,
Mm.
the biology of the sex act puts the woman at a disadvantage, right? Because there's a little bit of trauma, during the whole penetration, and so the whole act is a bit traumatizing to the vaginal mucosa. And now I'm using I'm using technical terms. So the skin in the vagina gets a bit traumatized during the sex act. This is why it's important. This is why foreplay, for instance, is very important, because when the area is not lubricated enough, you could end up with some friction burns or tears, which I spoke about in the article as well. And so you need to make sure that the person that you are going to have the encounter with is clean enough down there, because if the person has been outdoor with dust and sweat and all that mixed in there, if he's going to penetrate with a penis that is not clean, that could introduce some germs in there. And because of the traumatic process that you go through, you could have some small tears or some small friction burns in there, which makes it easier for germs to move into the bloodstream. So you don't want that to
Mm.
happen at all. So bathing could reduce that. But apart from that, if both of you, for instance, are office workers, there's not really been any outdoor activity much, then bathing would not necessarily add anything to the sex act.
Okay.
There's a second point that is even more dangerous. Now,
Okay.
the
Let's.
missionary, remember that the missionary gives the man pretty much full access to the woman. So now, if your partner, and here I'm talking about the male partner, is well endowed, and the woman also happens to have a bit of a short vaginal canal, there could be a challenge here where the penis might directly irritate the cervix. Now, I mean, nowadays, people are engaging in all sorts of weird sexual habits, right? Where they actually go all the way to try and stimulate the cervix. It's not every woman who actually enjoys their cervix being stimulated. And even though I don't have a cervix, what I've experienced from women talking to me about these experiences, and it can be quite painful, right? And so
Mm.
if your man is well endowed and you are in the missionary position, and he is especially not patient enough to make sure that you are lubricated well enough, and he just goes straight in and goes all the way and hits the cervix, it can really send the jolt up your spine, and that can literally kill the entire mood. And if that was it, if that was all, it would not have been so bad, but you could actually end up with some form of cervicitis, and cervicitis is an inflammation of the cervix, and that could then
Mm.
end you in the hospital for all the reasons you don't want to be. You don't want to be there. So those are the two things that make the missionary a bit. I mean, those are the two things that make the missionary make the list of dangerous sex positions.
Wow, 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 wow. Serious insights you're releasing here today. Okay, so that's fantastic. Your second pointer or your second sex position that you highlighted in your article talked about the doggy style, which is another favorite for a lot of men, especially, and women, actually. Um, let's talk about that.
So, depending on which resource you actually use, which resource material you're referring to, the doggy and the missionary actually switch positions. So one is either always first or the other second. So kind of like that. But yes, so the doggy style, it's also one of those positions that can make you or unmake you for a man. Depending on you and on the size of your penis. Now the doggy style is the position where the woman is on all four, either on all fours or any of the variations on the elbows or on the chest, whichever variation you want to use. But it places the buttocks right in front of the man. Now, depending on how endowed the man is, that can be a disadvantage or an advantage. If the man is not as well endowed and has the buttocks right in front of him, and he's also not skillful enough, the buttocks is going to take away from the size, so it's going to lose some size, some length, because you have to go through all the obstacle before you get to your destination. And so, if
Right.
the man is not skilled, it becomes a challenge. If the man is well endowed, this is also then a challenge for the woman, because if I mentioned for the missionary that you could actually hit the cervix. Some women find that pleasurable, but most women would not find that pleasurable. When it comes to the doggy style, that can actually happen more commonly. And you see, there's that animalistic feature in the doggy style where the man feels like he's in charge and he's going in and all that without thinking about what's going to happen. So if that man gets carried away and he pushes in too deep and too forcefully, you could end up, and this is the woman, you could end up with a vaginal tear. And this could actually, yes, this could actually be one of the most scary experiences for a couple, because the volume of blood that would gush out, the pain, it could actually, the reaction from the couple could actually even worsen the situation. So vaginal tear is possible, especially if the lubrication is inadequate and the angle of penetration is also not the best. You could end up with a vaginal tear. On the man's side, you could also, when you're doing a doggy and then there's a slip out, the penis might slip out, but then both partners may not have realized that it has slipped out because of the excitement at the height of the thing, and the man goes in to ram into the pelvic bone. You
Oh,
could, yes, you could
that
end up
even
with a
sounds painful.
penile fracture. Yes, the penis could actually be fractured in that split second. You see, so I guess what I'm trying to say is that it doesn't matter how enjoyable the situation is. You need to keep your bearings about it, because the doggy style, it could make you or unmake you depending on where you find yourself.
Wow, interesting. Very, very interesting. Okay, so and then you mentioned the reverse cowgirl or the cowgirl position. Let's talk about that.
Now, so this is from my experience. All the sex injuries, the major sex injuries that I have actually attended to, have been a result of the cowgirl and reverse cowgirl. So
Wow.
this is, yes. So this is actually a big deal. Now, the for the description of the position, basically the male partner would be sitting on a chair or edge of the bed, or just sitting in the bed, and then the female will be sitting on top of him. So here, the woman is the one in charge, in charge of the depth of penetration, in charge of the speed of the whole this whole intercourse. So the woman is running the show. Now, even though it's a very pleasurable position to be in, because the man literally has full access to the woman in front of him, it can also be dangerous. Again, similar to the doggy style. In the event of a slip, in the event of a slip, the woman coming down on the erect penis, with the gravity, because the one is coming down, it's difficult to pause mid-air. So she's coming down,
Yeah.
but there's a slip out. Both partners are not aware that there's a slip out. So that force of the pelvic bone hitting the penis can cause the penis to again bend into an unnatural position, and that could result in a fracture. And the thing about penile fracture is that, those, even though there's no bone in the penis, it is described as a fracture because when the penis is erect, it is quite firm. And so when it snaps into an unnatural position, it could result in breakage. A tear in
Wow.
the cavernous sinuses. Those are areas in the penis where blood goes to engorge for the penis to become erect, and that
Okay.
is one of the most painful experiences that a man can go through. And indeed, if you don't report to the emergency room for the appropriate treatment to be put in place, it's going to heal eventually, but it's going to leave an unnatural bend. So you don't want that unnatural bend in your penis. So if you go through something like that, you need to report and have it treated appropriately. So yes, there's treatment
Right.
available.
The next one you talked about was, I mean, you say we shouldn't. Well, I'm not saying you say we shouldn't do missionary or doggy style, but we need to be careful. Basically, that's what you're saying. But now we're saying, okay, if this is dangerous and can risk whatever, let's stand. Right? Let's stand. Problem solved. But now you're saying standing can also be
Yes,
dangerous.
because the thing is, you see, here's the thing: most people separate their sexual prowess or their sexual performance from their physical from their general physical health status, And so this young man or this middle-aged man hardly goes to the gym, hardly does any form of exercising, and then just because he's in the mood for standing sex, grabs this woman and they start doing it up in the air. Now, remember that your leg is part of your body. That leg needs to be conditioned properly. Now, should you develop a cramp in the middle of the act, what happens? Both of you are going to actually drop down, and the woman is going to get hurt more than the man because the woman, at least the man has some support with his legs, but the woman is up in the air. So if there's a cramp, both of you fall down. The woman ends up with a hip fracture because she's up in the air. I mean, that's a sex injury right there, Or because you needed the support, you put the woman against the wall and you're going ahead with the intercourse. During the intercourse, the woman might not feel anything, but afterwards you might notice scratches and abrasions on the back because of the wall. I mean, the irregular wall or what's the painful scratches from the wall. I mean, that again will be classified as a sex injury. But the most likely injury to happen again would be a vaginal tear, and this would be if your partner, the male partner again, is well endowed. So I think the lesson here is you need to know yourself and know your partner because the sex positions are every sex position is dependent on who is engaging in it. So if the male partner is well endowed, kind of similar to the cowgirl situation. Only that this case, the man is bringing you up and down onto his erect penis, right? Now, if he's well endowed, as you are coming down onto the erect penis, it could actually result in a tear because he's going to go all the way through to the end of the vagina, and then there's no more room to go, and then that's it. There's a tear. So if you know that your man is well endowed, there are some positions. This is one of the positions you want to avoid, especially if you know he's the kind of person that gets lost, that gets too excited and gets lost in the moment. You don't want to put yourself in that risky situation where you don't have any means of controlling the depth, of the penetration. It's very important. So the standing position, a lot of the accidents from the standing position are. I mean, you wouldn't see them as sex injury, but then when it comes to me as a medical practitioner, how did the injury happen? It happened during sex. That makes it a sex injury. So you may have fractured your hip, but that hip fracture happened because you were engaging in a standing sex, and then there was a cramp, and then one thing led to another, and now you are here in the hospital.
I have a quick question before we move on to the final position that you highlighted. So I know that a lot of blood sort of rushes down to the penis area to make it erect, right? Does it affect how much blood sort of circulates? Can it make a man lightheaded, for instance, during a standing position, where he could probably even pass out?
So it will not happen usually, but it can happen. You see, because when you are doing the standing sex, you are not only engaging. Let me take it from here. Sex is one of the things that actually exercises the whole body. So let's understand that when you are having sex, your whole body is involved. So there's actually, even though blood has been pulled in your penis to keep it erect, there's blood going through all your muscles because you are literally using all your muscles. So that's why sex actually, in fact, sex burns calories. I think it's 5 calories a minute. So sex is actually a good form of exercise to have. Now, with that background in mind, now you are engaged. Not only are you having sex, which is already burning calories and already putting a lot of blood into various muscles, right? Now you are standing, which means that you need additional resources in your leg muscles, and the leg muscles are some of the biggest muscles in the body. So in a long shot, it is possible to actually become lightheaded. You see, because as you are engaging in the sex and you are standing, your legs need to support the weight of 2 people. There's a lot of pulling of blood or movement of blood into the leg muscles to keep the person erect, and that can obviously cause some lightheadedness, which can end up with you collapsing on the floor. So that again, it puts you at risk of a sex injury. So depending on your conditioning as a person, you might want to avoid the standing sex position. But if you are somebody who is fit, somebody who is already well built, I mean, this is actually a great position to engage in, provided you are not too well endowed that can cause injury to your partner.
Makes sense. Okay, let's move on to the final sex position you highlighted, and that was oral sex. Now, I can straight away see, I mean, from my own lay perspective, how this can be dangerous, but please indulge me.
So I mean, this can be dangerous in so many ways. I mean, physically, you could end up with injury in the sense that now again people are doing a whole lot of crazy things. There's something that they now call deep throat. So yes, I mean, women are trying to swallow the entire length of the penis in their mouth. I don't know how that gets some people off, but hey, that's it's happening, and
Mm.
people can actually come to the emergency room with irritations or inflammation in their throat. And what's the cause? Deep throat. I don't get it, but it's happening, you know.
Mm.
And then we also have men, when you go down on a woman and at the height of pleasure, and I put a description in the article. The power in the thigh muscle of a woman is definitely stronger than the power in your jaw. So now, if your woman at the height of climax closes up her thighs on your jaw, you know, and it's I'm sure you can picture it. It can actually result
Mm.
in a dislocation of your jaw. So that's also
Crazy.
another injury right there. And so and of course we also have the infections and all that. If somebody has an ulcer in the mouth and then is engaging in oral sex, that person can transfer infection to you, and then you can also transfer infection to that person through that mouth ulcer. So all these are ways that you could end up in the emergency or in the hospital following an oral sex.
Yeah, I mean, it's quite scary the way you talk about it, but I'm so glad that we're having this conversation today because people need to know. People need to know, and we're not, as a human race, about to stop having sex, right? So I'm glad that you highlighted, all these things, and I think it's a very important conversation to have, especially to people who are sexually active, plan on having children one day and all that kind of thing. So yeah, it's been great. Thank you so much. You're on YouTube yourself, are you
Yes,
not?
I am. And
What's your channel? What's your channel name? Let's give your channel a shout out, shall
it's
we?
the same name, so Kelvin Owusu MD. That's my channel name.
Awesome, awesome. I think you joined just recently, but you should have joined a long time ago so we could start having some of these conversations. But it's been absolutely amazing. Thank you so much for your time and of course for your professional perspective on this matter. And yeah, we'll definitely do this again very soon.
And thank you very much for having me. I'm always excited when you call.
Thank you. Thank you. Right. So, for those of you watching, I mean, I hope that you have learned a thing or two. This is real, okay? If you're going to engage in sex, make sure that you're doing it the right way. So, not only does it will stay pleasurable throughout for both partners, okay? If you like this video, don't forget to smash the like button. Don't forget to subscribe. And I will catch you in the next one. Cheers.